Hello, welcome to Menorah Medical Center. I'm Dr. Lina O'Brien, Director of the Colorectal and Robotic Surgery programs at Menorah. My partners and I are some of the most experienced colorectal surgeons in the Midwest. At Menorah, we have been designated a Center of Excellence in Colorectal and Robotic Surgery through the Surgical Review Corporation. We provide surgical treatment for many bowel issues from diverticulitis, ulcerative colitis, Crohn's disease, and colon and rectal cancers. We have one of the lowest rates of colorectal surgical site infections for HCA hospitals. The goal of this video series is to help you understand what to expect before, during, and after your procedure. After you've been seen in the office by one of our team members and your plan has been thoroughly discussed, we will schedule your surgery. Prior to surgery, you will meet with a member of the anesthesiology team, and you may attend a pre-op class hosted by our colorectal coordinator, depending on your surgery. This class gives you detailed instructions on what to expect after surgery. You will have to do a prep prior to surgery, and you will receive instructions from our office, and all of the medications are called into your pharmacy to complete the prep. It is important to stay hydrated while doing the prep. Please have plenty of non-caffeinated clear liquids for intake. Most patients are on a clear liquid diet at least the day before surgery, but this can vary on a case-by-case basis. The day after your surgery, we will again focus on getting adequate hydration, advancing your diet, removing all lines, IV fluids, catheters, and walking. We encourage all of our patients to walk in the halls while in the hospital as much as possible. This helps awaken your bowels and speed your recovery. Some of our surgeries do require a temporary colostomy or ileostomy to allow the best outcome. These are not always permanent, but necessary to allow your body to have time to recover and heal. If you have an ostomy nurse will begin teaching in the hospital, and home health will be set up prior to dismissal. At Menorah, we do provide an outpatient ostomy clinic, so if there are any issues once you go home, we can schedule you to be seen in the clinic to help you navigate through any challenges. The possibility of an ostomy should be discussed with your surgeon. You will have some activity restrictions after surgery. We ask that you refrain from lifting anything greater than 10 to 15 pounds for 6 weeks. Not adhering to this would put you at increased risk for a hernia, which could result in additional surgeries. However, we do encourage you to walk as much as you can, and it is okay to go up and down stairs. The typical length of stay for our patients is usually 2 to 4 nights. The length of stay can depend on whether the surgery is done robotically, open, your current health, and your disease state. The first follow-up appointment is typically in 2 to 3 weeks after you've been discharged from the hospital, and at that time we will give you further clearances for work and activity. Depending on your surgery, you may leave the hospital on a full liquid diet for a few days. This will be in your discharge instructions. After that, you'll stay on a low fiber diet for about a week. Now, a low fiber diet is less than 13 grams of fiber a day. You'll need to avoid most raw fruits and vegetables with skins for about the first week or so. You can have cooked vegetables, but please avoid those with skins or seeds. You may have meat, such as poultry or fish, but we do like you to avoid steak because it is too difficult to digest immediately after surgery. We'd like you to choose breads, pastas, and crackers made with white refined flour instead of whole grain foods. This allows your stool to move more easily through your bowels until the inflammation and swelling goes down from surgery. Again, hydration is very important, so please continue to drink plenty of fluid. Thank you so much for selecting our team for your surgery. We are here for you throughout this journey. If you have additional questions or concerns, please contact your surgeon or our colorectal program coordinator at 913-498-7390.